work. So they can come during that, or we have one scheduled for the 2nd of November in Pana at the fire station there.
Okay.
And that one's from 9 to noon. So
perfect. All right. So these are some
hoping to see
drive-through
people
ones.
come. Yeah.
Definitely. You've gotten some calls about shots, and we're talking flu shots right now, but these are coming down the way here. Registration, anything for events like these with the drive-ups?
No. For the drive-through, no. If it's just show up, there'll be a line process. So there'll be someone to have you do the paperwork, and then you drive up to the next. The nurse will give you the shot in the car, and then you just drive off. So
Perfect.
don't even have to get out of your car.
Brings you back to the COVID-19 days, those long testing sites right there, but makes it easy for you. So those are some really good days there. You got the dates off the top of your head one more time for these 2 drive-through days?
October 24th in Taylorville and November 2nd in Pana. Perfect. At the fire stations.
Perfect. Both at the fire stations in Taylorville and Pana. And those dates are up at TaylorvilleDailyNews.com, or you can find them on the Christian County Health Department website, I'm sure there. All right, awesome. So you've been getting some calls about COVID shots. I mean, it's the season where COVID is starting to fire back up a little bit. What's the word on that?
Yeah, so we just got our COVID shots in recently. I think it was Friday of last week they finally arrived. So this is the new COVID booster. It also replaces all previous COVID shots that had been in existence are now completely gone, phased out. So if you've never had a shot, this replaces like your first time shot, but it also is a booster for if you are due for a booster. So we have had quite a lot of people who've called in and are on a waiting list. So I think what we had ordered, we're going to essentially use all of it right now. We weren't expecting such a large number. We ordered like 200 because the vaccine's only good for so many days, and we weren't expecting to have this many come in and use it all already. So we now have a waiting list of over 100 people. So we're going to order a lot more now.
Yeah.
But what we found out is that a lot of primary care physicians who had carried it during COVID aren't carrying it anymore. A lot of places like Walgreens, CVS had originally carried it. I mean, and they still are carrying it. But now that the pandemic is over and the mandate is over, that it used to be free, it's no longer free. You have to have insurance for it to be covered. But at the health department, we have a program called the VFC and the Bridge Access Program, which allows kids and adults to get the vaccine for free if they're uninsured or underinsured. So I think we'll be seeing a lot more, because I don't know what other venues or possibilities some of them who are uninsured or underinsured who want it can get it without essentially the help of the health department.
Yeah. This is very important to note here, because so many people might not know that, vaccines now for COVID, they're not free anymore. At the beginning of the pandemic days, you could go in and they're begging you to get a vaccine, but now it's just not the case. So it's great that the Christian County Health Department has this program here. Well, what does this look like? You have to meet a certain level of uninsured or underinsured to get that, or do you have to fill out paperwork?
Yeah, just again, paperwork. If you just let us know that you're uninsured, because we have to store, it's the same vaccine, but we have to store them separately and report them separately. So it's just easier for us to know that, we need to pull from this fridge versus this fridge of the vaccine. We don't want you to come in saying, you want a COVID vaccine, and we give you a private insurance shot and then bill you, and you're like, wait, I'm uninsured, and then it's kind of like it's going to cause issues. So if you just let people know, is either when you call in to the health department, let them know, or when you arrive, so that they give you the correct paperwork to fill out for private insurance or underinsured or not insured.
Sure. You mentioned that people with, already going through their first couple of phases of vaccines, maybe a booster, those have been phased out, you said. So they'll be okay, right? I know I'm just like, they'll be okay, but those are no longer viable for the viruses that are out there now.
Yeah, because the variant continues to change, and this is based on the new variant that is being seen. So the previous vaccines from IDPH, from what I understood is that, I mean, it's effective, but this one is like more effective because of the changing of the variant. So they just phased, and we previous vaccines that we had to destroy and send back. So this is now the vaccine, the only vaccine that's being offered right now.
All right. Yeah. There was a time when, there's 3 or 4 vaccines out there, and you said you had to destroy all vaccines. What does that process look like? Is there a special waste paper basket for this?
Oh, I'd have to ask the nurses. I'm not sure how they got rid of it.
Sounds very serious when you have to get rid of it. And I understand it. You got to get rid of vaccines that do not work anymore, but there's a process for that as well. For all of this information, COVID vaccines, flu shots, calling the health department always works. The website always works. What's the phone number for
217-824-4113.
Perfect. All right. And then any questions can be answered there. You say the phone's been ringing off the hook. What have been people been talking about with the COVID vaccine? I was not, expecting that big call for vaccines were going to be needed right now.
Well, I mean, like, people have been, I think, mostly it's the population 65 and older who know that it's been a year since their last one, and they've been wanting it essentially with their flu as well, because you can get the flu and COVID at the same time. So I think it's a lot of that they knew it was coming, and the FDA was just taking a while to get it out. So as soon as it was released, everyone was, can I have it? Can I have it? Can I have it? But as you got to put the order in, and you got to wait for it to come. And so it's not just because they say it's approved doesn't mean we have it the next day. So we ordered it the next day, but it took a while to get in. So it's in there now.
Yeah. It seems like a lot of these processes that happen at the health department, you're responding to things all the time. It seems like, things aren't going to be happening, right away, right? The snap of a finger, you're going to have to order things. So that was the first thing you did, was ordered more vaccines. It's really important for the community. Now, do you think because you have more do you think you're going to get a little bit more looks with COVID vaccines?
Yeah, because we had looked on numbers that we had done last year, so that's why we kind of ordered, because the thing is that the vaccine can only last 30 days before it dies, so we didn't want to order thousands, and it doesn't last more than 30 days. But then we saw a huge intake and need, and then when we started asking, why is there more people coming this year than last year? Oh, because primary care physicians aren't issuing it anymore. And then the issue with the underinsured and not insured needing, if they want it, and not finding that option besides the health department.
Sure. What does the life look like on this vaccine? Is it like others, about a year?
Yeah, it'll probably, I don't know what, it seems to change. Seems to be, I don't know what will happen in the future, but yeah, this is it for the season for this year.
All right. Well, COVID-19 vaccines. Are we still calling it COVID-19 or just COVID?
Either one. I've heard both.
Everyone knows what you're talking about. Vaccines are available at the Christian County Health Department, and there's a wait list now, but you can get on the list for that. There's a big need for them. And flu shot clinics coming to Springfield, coming to Taylorville and Pana here in just this month, and November 2nd. I think it's October 24th for Taylorville. Awesome. October 24th. Got that right. We'll be back here with Dr. Chad Anderson, the Public Health Administrator for the Christian County Health Department. In just a little bit, we're going to take our break here. My name is Tim Zalabak. You're listening to the WTIM Morning Show.
Your information station, WTIM.
Farmers significantly reduce input costs with Black Coral Minerals Food Grade Liquid Fertilizer and Biostimulant. It's non-toxic and non-carcinogenic. Save money. Supercharge root development. Improve till, porosity, and soil quality at the same time. Call 314-440-3662, 314-440-3662, or visit blackcoralminerals.com.
Kimmer Village in Assumption has supported children and families for over 100 years, and our programs continue to grow and thrive. This is Shalis Nagel, Executive Director with Kimmer Village. Our donors help us maintain quality services and our important mission. You can join our mission through your donation at kimmervillage.org/donate.
With their street reopened, the all-new American Eagle restaurant at 102 East Park in Taylorville invites your family to join them for breakfast, lunch, or dinner from 6 a.m. to 9 p.m. 7 days a week. Whether it's breakfast, lunch, or dinner, everything is made from scratch, and you'll know it when it hits your taste buds. They welcome to-go orders and reservations for families and groups to use their large meeting room. Their streets reopened, and the American Eagle restaurant is ready to serve you breakfast, lunch, or dinner 7 days a week. They're at 102 East Park in Taylorville.
The eye care specialists at Advanced Eye Care in Taylorville consists of doctors with specialization in a wide range of ophthalmology and optometry fields. Dr. Smothers Champley and Dr. Craigs are qualified doctors who will do a complete eye exam and offer a perfect fit in eyewear or contact lenses. These doctors can diagnose and treat many eye health and vision conditions. Call Advanced Eye Care today at 824-4991. That's 824-4991 to schedule an appointment. Advanced Eye Care. Modern eye care. Old-fashioned caring.
I'm Police Chief Andrew Pistorius with the Sullivan Police Department, here to talk about a topic no one wants to discuss, depression that many times leads to suicide. When a person is going through such feelings, many times family and friends don't know how to help, but there is help. If you feel depressed or lonely, there are many resources to help you. Call a trusted relative, friend, or minister, or call the Suicide Prevention Lifeline toll-free at 800-273-TALK. That's 800-273-TALK. All of us are here to help.
Find out about available lots for lease at Hillcrest Park or Bailey Park in Taylorville for you to become a member of either mobile home community by clicking their icon on TaylorvilleDailyNews.com. Hillcrest Park or Bailey Park in Taylorville.
The Shelby County Economic Development Corporation aims to foster, promote, and stimulate economic development. They're here to help your business grow. Find out more on the Shelby County Economic Development Corporation by clicking their icon at TaylorvilleDailyNews.com.
Your information station, WTIM.
Welcome back to the WTIM Morning Show. My name is Tim Zalabak, your host. Joining me in my studio today is Dr. Chad Anderson, the Public Health Administrator for the Christian County Health Department. We appreciate him being in our studios today. Let's thank our sponsors that make this show possible. People's Bank and Trust, where they put people first, and Landmark of Taylorville. You always do better at Landmark. So we were talking about some flu shot and vaccine clinics coming up here in the next couple of weeks here and into November 2nd. There'll be one at the Pana Fire Department, and on October 24th at the Taylorville Fire Department. These are drive-through clinics, and the Christian County Health Department will be having vaccines for COVID soon. There's a wait list, but they will be getting to the ground soon. Dr. Anderson, once again, thank you so much for being here with me.
Thank you again.
Yeah, absolutely. So the people that staff these drive-through clinics and people that are needed at any given moment, MRCs. We talked about them last time. Tell me more about that.
Mm-hmm. So, I mean, the MRC stands for the Medical Reserve Corps. So it's a program at the health department where when there's not enough staff, or if there's, for example, like an emergency, like there'd be a hazardous spill, or there'd be a crash or something that we need to respond to, but there's not enough people at the health department, there can be volunteers in the community. So, I mean, we obviously look for, nurses and doctors on the MRC. For example, like at the flu clinic, we have 2 nurses, but if we have an influx of, cars, it's nice to have someone who's in the community who's a nurse to be able to assist us in getting those, so we can move, twice as quickly, or, more quickly than we could with just the 2 nurses. But it doesn't have to be someone who's in, a medical profession. It could be someone who, you work at the cafeteria at the school, or you are a cash register at, Kroger over here. It could be anyone. So, I mean, I think that's a misconception sometimes, is that you have to be something medically related, and it doesn't. You can be anything. We'll find work for you if you want to volunteer your time.
Without a doubt, if you find that call to work right there, that call to action, Dr. Chad Anderson can put you to work. There's always work to be done with the Christian County Health Department. But I mean, having a background in the medical field, being a registered nurse, also a big help. And I imagine these drive-through clinics with 2 nurses would not be an easy task. I mean, if you have 2 more people that maybe can just accept cars and direct traffic, that would make a difference.
Exactly. Yeah. So that's why I said he doesn't have to be a nurse. It can just be someone to help move traffic, or give out the paperwork, making sure it's filled out. It's all those kind of things.
Sure. Awesome. So MRCs, their Medical Reserve Corps right there. And they can call the health department one more time if they need to.
Yeah, we've got tons of brochures and things on how to sign up, how to be active, how to get involved. All, if you want more information, there's tons of brochures and pamphlets.
Awesome.
At the health department.
Awesome. If you want to get involved in the MRC program, maybe become valuable in a tough situation like that, it's a great opportunity to do so with the Christian County Health Department. Anything more on MRCs or in any flu shot vaccine clinics?
Not that I can think of. No, not
right.
Specifically.
Well, then let's talk about lead, because that's where we got cut off last time. Let's talk a little bit about lead. This is it's a pretty nasty thing out there, and people are still, ailing from it a little bit. So there's programs with the Christian County Health Department that help.
So we have, as I was saying last time, if you have lead in your house, and from what I've been seeing as the administrator here, there's quite a lot of houses that do. So we had applied for a program because we know that a lot of these houses are older. People don't have money to remove the lead or do the renovations that are needed, because they can be costly, because they have to be removed by a lead abatement contractor. You can't just do it yourself, or just hire a regular contractor. It has to be a lead abatement contractor who's licensed through IDPH on top of that. So, and those are far and few between, and because supply and demand, they can charge what they want. So with the grant that we were able to write and get, this grant will pay for the lead removal. So, there's a lot of, hoops to jump through to get to it. You can't just say, hey, come remove my lead, and we just come over. You have to test for the lead in the home. Someone has to have at least tested positive, or you have to have a child that has a potential for testing positive in the home. So it's a several hoops and things to jump through, but it is a program that we saw a need for, and are now trying to get people to at least call in and let us know, so that we can start that process.
Some hoops to jump through for sure, but this is an important grant that has been written, and some money that we've gotten, because you got to have someone initially come out and test for that. Also, is that also covered by you guys?
Yeah. So so our lead inspectors at the health department will come out and test. They'll test to see, is the lead in the paint. They'll take dust samples, see if it's from the residue. They'll take a water sample, it could be a lead pipe. They'll test, they'll do a soil sample, it could be been in the soil. If you have older ceramics or toys, sometimes, especially older toys, can have lead paint, on them or in them. They'll test those, see if that's where it's coming from. If it's just that, they'll just suggest throwing that away. But if you've got lead paint, or on the outside or the inside of the house, or lead pipes, that's not something you can just get rid of. And that's when then the inspectors would then notify the lead abatement contractor that, hey, we've identified there is lead in the home, there is a need for it to be removed. And then the lead contractor will go in and see, the damages of what is needed to get removed, and how much, and et cetera, et cetera, et cetera.
All right. All of these services are with the Christian County Health Department. And Dr. Anderson, we're out of time. I appreciate you for being here with us today.
Thank you for having me.
Without a doubt, that's Dr. Chad Anderson, Public Health Administrator for the Christian County Health Department. What a great interview today. This has been Tim Zalabak here on the WTIM Morning Show.
News, I'm Rich Thomason. President Biden travels to Israel tomorrow. The visit meant to demonstrate America's support